Hello, it's good to see you. My name is Dr. Jordan, but I like to keep things casual and relaxed, so please call me Joe. As you may have guessed, I'll be your dentist today. And you are... Great. Well, I'm pleased to meet you. I've got your medical and dental history here on my computer screen, and while I take a look at that, why don't you go ahead and tell me what brings you to the office today? Okay. Got it. So you're experiencing some discomfort on both sides of your mouth. Is the discomfort upper, lower? Both, okay. And is it left or right? Both again. All right, 2 for 2. Now talk to me about when you say discomfort. Would you say it's an actual pain, or would you say it's more of a pressure, a sensitivity perhaps? Okay, got it. So more like a pressure. And would you say you feel this pressure more acutely during a particular part of the day, maybe morning, afternoon, evening? Okay, so the feeling of pressure is fairly consistent throughout the day, but it's been difficult sleeping the last few nights. No, I can understand that. And when did you first begin to notice the pressure? I see. Okay, got it. So about 2 weeks ago, and it's been slowly intensifying from there. Well, based on what you've told me thus far, it being pressure, not pain, the discomfort being fairly consistent throughout the day, the sudden onset, and the location, of course, in your mouth, and based on what I see here on my screen from your chart, I'm fairly certain your wisdom teeth are coming in. So all of the symptoms you reported are completely normal. I don't want you to be worried about that in any capacity. And as far as procedures are concerned, it's generally a relatively simple extraction process when it comes to wisdom teeth. But I'll go over all of that once we take a look at your x-rays. Speaking of which, I'm going to have Denise come in and take you over to our digital panoramic x-ray machine. She'll take a picture, send it over to me. We'll take a look at it together. I'll do the actual physical exam, make some recommendations, and you'll be on your way. So I will see you in just a minute. All right, welcome back. How was that? Painless, I hope. Good. I'm glad to hear it. I have to admit, I took a sneak peek at your x-ray before you came in, and as I suspected, it is indeed your wisdom teeth coming in. So, I have it here on the screen, and we can take a look at it together. Let's see. Let's see, where are we? Alrighty. So this is a full picture of your mouth that we just took, and you can see that your wisdom teeth, number 16, the upper left, number 17, lower right is coming in, and then on the other side, number 1, up at the top here, is coming in, as is the number 32, your lower right, coming in. So that's the cause of some of that discomfort and pressure you're experiencing. And you're actually in good shape. One of the things that I look for on these x-rays is, I don't know if you can see, but there's a white little line right here that runs on the jaw on both sides. And that's called your inferior alveolar nerve. And what we look for in determining what procedure we're going to perform for extracting the wisdom tooth is whether or not the roots of the wisdom tooth make contact with that nerve, and fortunately yours don't, which means the extraction process is going to be a relatively simple one. And again, we lucked out there. Now, for your uppers, just a quick anatomy lesson for you. This picture is actually reversed, it's backwards. You can see the computer automatically puts the R for right and L for left. So this picture, X-ray, is like I'm looking at you eye to eye. So even though this is on the left side of the screen, this is actually the right side of your face. Right side of the screen, left side of your face. So you can see your right sinus, your nasal cavity, and then your left sinus, your jaw joint there. But anyway, you can see just how close your wisdom teeth are to actually coming into that sinus. So it'll be a little tricky, but nothing we can't handle. So good news there. And as far as the overall look at your mouth, I'm pretty impressed. Nothing stands out too alarming to me. And then of course these are the bite wings that Denise took for us. So this is the right side of your mouth. Your wisdom teeth are to the left over here. These are the first and second molars. This view just gives us more detail of what we're looking at. So you can see the white parts here are actually fillings that you've previously had. And these are actually amalgam fillings, silver fillings, which is why they show up so brightly on the X-ray. And this, of course, is the left side of your face. Again, first molar, second molar, your wisdom teeth would be over here once they come in. Again, you've had some, fillings done on these back molars. Now you've also had a filling here on number 19, but you can see how it's a little different color. See how bright the amalgam is? This one here is actually a composite filling, which is a white tooth-colored resin that we actually use exclusively here in this office. We're an amalgam-free, mercury-free office. So one of my recommendations, which we'll get to in just a second, would be eventually, it's certainly not a pressing issue, would be actually drilling out all of your amalgam fillings and then replacing them with composite, just like number 19 is here. So as far as the wisdom teeth are concerned, like I said, this will be a fairly simple procedure. What we'll go ahead and do is it'll just be a local anesthetic needle, and what I'll have you do is come into the office on whatever day we schedule this, maybe 20-25 minutes earlier than your actual appointment. And what I'll do for you, because believe me, pain-free is the way to be, and that's my goal. So what I'll do is actually treat you with something called benzocaine, and this is a topical anesthetic. And what I'll do is, this is just a mold. I'll actually apply the topical anesthetic to the exterior of your gum, and that way when I actually inject you with the needle, you won't even feel the needle going in. So you'll have a topical anesthetic put on with just a cotton swab. You won't even feel that. We'll let that rest for 15-20 minutes. Maybe do one additional application of the benzocaine, and then that way when it actually comes time to injecting you with the Novocaine, you won't even feel the needle going in. So that's easy peasy. Alright, so I think now what we'll do is, since we've got a good look at your x-rays, we'll go ahead and do the physical exam just to make sure everything checks out okay. You know, it's so important that people have routine dental checkups at least once a year. We definitely recommend twice a year, you know, getting your teeth cleaned every 6 months, but certainly you want to do it once a year. And I know just looking at your chart here on the screen, it's been a little over that for you. But having regular screenings from, you know, a dental practitioner is so important because it's the first line of defense in actually detecting oral cancers. So we'll go ahead and take a look and see what's going on inside your mouth. And this will be pain-free. You don't have to worry about it. I'm not going to be poking or prodding too much. And I just want to confirm that there's nothing else going on inside your mouth. And then I'll actually go ahead and I'm going to write everything down here on this treatment plan evaluation sheet for you. I'll make a copy for our records, and then you can take one home and you can go over it with you know, whomever you need to. All right, so let's go over here and we'll take a look. All right, open up for me real wide. All right, let's see. All right, I'm going to start with your upper right. Real quick, the number of teeth, your teeth numbers, you have 32 teeth, and they're numbered from the upper right all the way. The wisdom tooth is number 1, and it goes all the way over to number 16, which is the wisdom tooth opposite the upper right, so the upper left. And then 17 is right below on the lower left, comes all the way around to number 32, which is your lower right wisdom tooth. So 16 on top, 16 on bottom. Alrighty. Let's see what's going on here. Alrighty. And I can now get a pretty good look at your wisdom teeth finally. And yeah, there's definitely some swelling, very red in here, so we don't want to put off having these done, extracted rather, for too much longer. Alright, so let's go ahead and write that down. Oops. Alright, so we're going to go ahead and extract, and extract right off the bat, because we know those 4 have got to go. Alrighty. And then I'm going to go ahead, you know, like I mentioned, changing out eventually your amalgam fillings to composite fillings. I'm going to go ahead and I'll write those down here on the treatment plan just so we can remain aware of it. Alrighty, so looks like we're going to go ahead and do number 2. We're going to do the occlusal, amalgam to composite. And occlusal, just real quick, is a surface of the tooth. So occlusal is the biting surface of the tooth. And we have various cusps, which are the points on all the various teeth. And then if we look at the side of the tooth that faces the cheek, this side, that's called facial. A long time ago, it used to be called buckle, but more and more you're seeing doctors and dental practitioners refer to it as facial, which is a little easier to remember since it faces the cheek, the face. Makes sense. If the surface is facing the tongue, that is called your lingual, obviously, for the Latin word for tongue, lingual. And then if it's on the back of the tooth, it is called distal. And I always remember distal starts with D, which means, for me, distance, as far as getting away from the center line of the mouth. So distance, D, is the back. And then the front of the tooth is called mesial. And I remember mesial because middle and M, mesial, means we're going toward the middle of the mouth. So D, distal, distance away from the center, mesial, middle, going toward the middle. So when you hear me write O, that means occlusal. So we're talking about that top portion, again, of the tooth. Alrighty, so occlusal, we've got that amalgam to composite, which is great. And then nothing else going on that side of your mouth, so you're good to go there. Let's drop down here, and again, we're going to go ahead and do occlusal, the chewing surface. We are going to go ahead and change that from amalgam to composite. Number 30, we're going to go ahead and do occlusal. That's a bigger filling that you have there. So that's going to be occlusal distal amalgam to composite. And let's go ahead and get back in your mouth. Check out the other side. Alrighty, let's see. Open wide and try to move your tongue to the right side of your mouth just a little bit for me. Perfect. Good, good, good. Alrighty then. Yeah. Everything checks out pretty good. I'll just go ahead and indicate what we want to go ahead and do for the left side of your mouth again. Number 18, we're going to go ahead and do occlusal, biting surface. Change that from amalgam to composite. And then 19, it looks like, let's see. It looks like there might be a little something. Let's see if we can spot it on our x-ray. Looks like you already have a filling there. That's the composite, the one white composite that we have. Let's see, how do we zoom in here? There we go. Alright, so I don't know if you can see it, but there's a teeny tiny little grayish black area right underneath the composite filling. So I'm gonna just make a note of it. It's nothing that we have to go in for right away. I don't want to drill up that filling just to go exploring. So eventually, we'll monitor it in 6 months when you come back for your regular cleaning and checkup. We'll do another x-ray, and if it looks like it's grown a little bit, then we'll go ahead and go in and take a look. So we'll go ahead and watch for comp. Alright, and that's right in the center there on that cusp. Alright, and then your upper left, we're going to go ahead and do number 14, occlusal amalgam to composite, and we're going to draw that. Good deal. And then 15 is a little bit bigger filling. So that's occlusal, the biting surface, and facial, facing your cheek. Alright, perfect. So like I said, taking a look at that x-ray, everything looks pretty good. You're in good shape. So we'll go ahead and get rid of these wisdom teeth for you. And what I will probably do is I'll go ahead and write you a script for, a mild pain reliever, and that'll get you through the next couple days or week, depending on when you're going to be able to come back in. And that way you can at least sleep at night, because I remember when my wisdom teeth came in, it was not something that was enjoyable. So I feel your pain there. And then I know you were asking Denise while you were getting your x-ray done about some various procedures as far as teeth whitening is concerned. And we're a multifaceted office, so that's something that we can certainly do for you. That's not a problem. Generally speaking, there are two types of whitening: either in-office whitening, which is like, I'm sure you've heard of Zoom whitening, and that uses lights to actually whiten the teeth. But what I recommend is at-home whitening, and we accomplish this by taking an actual cast of your mouth, and actually what we were using earlier is part of that at-home whitening bleach system. So what we'll do is we take a mold of your mouth just like this, and then what we do is we actually make custom trays that fit, that's the lower, over the mold. And so what you'll do is, if I can get it on, fits just like that, and this is how we'll present it to you, just like this, in a little take-home case like that. And when you get home at night, when you brush your teeth, what you'll do is, after you've brushed your teeth, used your mouthwash, definitely floss before you do this, you can take the bleaching prescription gel, and actually, I don't think this one is a prescription strength. No, this is just over the counter. You do have to buy it at a dental office, but this one's not a prescription at any rate. And what you do is you just fill the tray with gel. I usually recommend to patients that they not fill the back portion, because this gel is pretty expensive. I think we charge $50 for 3 syringes full. So it does last a while. I think each syringe should probably last you a month, depending on how much you use and depending on if you're going to be doing upper and lower. But that's why I recommend don't do the back teeth, because nobody sees them anyway. But fill the tray, and then what you actually do is you put this into your mouth. So assuming we filled this, you would put it into your mouth, and what it does is the gel spreads all along the teeth, and depending on the strength of the gel will depend on how long you actually have to wear the tray itself. Usually I fall asleep with mine, which is fine. The gel, the peroxide in the gel doesn't last forever. Usually after an hour, the chemical reaction is stopped and it no longer does any whitening. But this is 32%, so it's 32% peroxide, which is pretty strong, and it's amazing the results that you can get. People report all the time, and I've seen it myself. People going 2, 3, 4, 5 shades up in one night. That's how amazing this stuff is, and it's a little bit more cost effective, at least in this office, than the Zoom is. So that's something to consider once we do the wisdom teeth, because as you can see here, this particular mold does not have the wisdom teeth. This is the first molar, second molar, and this is where the third molar, the wisdom tooth, would be. So we don't want to make a mold of your mouth with the wisdom teeth coming in, because then as soon as we extract them, the mold, the tray itself won't fit. So we'll go ahead and, if this is something you want to look into afterwards, that's not a problem. So we'll go ahead and do the wisdom teeth first, and then let you heal up after that, and then we can move on to some cosmetic procedures. Let's see. Was there any other questions you were concerned about? I guess I should do my due diligence and go through the list. How often are you brushing? Okay, good. And I can see that's probably true. 3 times a day, that's a lot. Although I guess I brush 3 times a day, breakfast, lunch, and dinner, but most people don't. And then talk to me about flossing. How frequently do we floss? Okay, good. Yeah, I hated flossing growing up, and even into my early 20s, I hated it. It was just such a hassle. Having to unwind the floss itself and then trying to stick your fingers into your mouth, and what a pain. But eventually, and I don't have it here with me, but there is a product called Reach, and it looks similar to this. It has a long handle, and at the end of it is a pre-drawn head of floss that you can pop on and off. They're disposable, and what you do is just, when you're flossing, you put it in your mouth just like a toothbrush and go up and down, up and down, up and down in between each of the teeth, and it makes it so easy to floss. And after I'm brushing at night or after lunch, I'll just sit at my desk or at the couch watching TV, whatever's on, and just floss for a couple minutes, and I'm telling you, it's a lifesaver. So Reach, if you can find that I think I bought mine at Walgreens. Definitely recommend. So I think that's about it. I'm really happy with your at-home dental hygiene and maintenance. So let's go ahead and get you scheduled before you go out for sometime next week, whatever works for your schedule, and we'll get the wisdom teeth extracted, and then we'll let you heal up and for a couple weeks at least, and then we'll bring you back in. We'll go ahead and do that bleaching splint for you, and looks like you'll be good as new. All right, well, it was awesome getting to work with you. I'm really happy you stopped by, and I hope this is the start of a long relationship. All right, so if you have any questions on your way out, I'll give you my email and my cell phone. Please, by all means, do not hesitate to call me day or night if you have any questions or concerns or problems, okay? All right, well, thanks so much again, and I'll see you soon.